Hi, my name is DeLisa Fairweather, and I'm a PhD researcher at Mayo Clinic and the corresponding author on our recent JCI paper, where we estimate the prevalence of autoimmune diseases in the US using electronic health record data. I'm also a committee member of a National Academy of Sciences committee where we looked at autoimmune disease research in the United States. The committee was really astonished to find that there were no current estimates and no accurate estimates of the prevalence of autoimmune disease in the US, either for all autoimmune diseases or individual autoimmune diseases. This kind of data is really critical for us to get funding for research in the future and also to understand better if autoimmune disease is changing over time, if the therapies that we're using are working. And this information is available for other chronic inflammatory diseases like heart disease and also cancer. So I was really lucky then to meet Erin, who is an expert in autoimmune diseases and also a programmer. Erin.
Hello, I'm Aaron Abend, the first and co-senior author of the paper with DeLisa. When my mother was diagnosed with Sjogren's disease in 2013, I started researching autoimmune disease and I found a huge gap in the data to support research and patient care. I founded the nonprofit Autoimmune Registry in 2015, and our first research project was to determine how many people in the US have at least one autoimmune disease. A study in Denmark in 2006 by Doctors Eaton and Rose had used electronic medical records to look at 30 diseases and used a single code to classify a patient as having disease. In the US, though, because a single code often means that a patient's being ruled out for that disease, we needed to find an algorithm that would screen those patients out. We determined that two codes at least 30 days apart did a good job of that, and that algorithm compared closely with a sophisticated machine learning algorithm developed for rheumatoid arthritis at Mass General Brigham using the eMERGE network. To determine which diseases to include, we used the book The Autoimmune Diseases by Doctors Noel Rose and Ian McKay and looked for descriptions that clearly showed tissue-specific antibody or T-cell activity or immune system dysfunction that led to the destruction of otherwise healthy tissue. 105 diseases met these criteria, and that list was reviewed by our scientific advisory board, which includes the newly appointed editor of the book, Dr. George Sokos, and many other leading experts in the field. Ingrid?
Hi, my name is Ingrid He. I'm the president of the Autoimmune Registry, and I'm also one of the co-authors for this paper. So for the study, we looked at EHR data from 6 large hospital systems in the United States. These 6 large hospital systems are located in the states highlighted in green on the map here. We examined the 105 autoimmune diseases by age and sex, and then extrapolated the findings to the US Census population. What we found was that 15.5 million people in the United States are diagnosed with at least one autoimmune disease. That amounts to 4.6% of the overall US population, 6% of the female population, and 3% of the male population. This also meant that women were 2 times more likely than men to be diagnosed with an autoimmune disease. Moreover, we found that 24% of patients have been diagnosed with 2 autoimmune diseases, whereas 8% of patients have been diagnosed with 3 autoimmune diseases. Our data on prevalence is the most accurate to date.
One of the striking findings of our study is the sex difference. And in this table here, taken from the paper, you can see the top 10 autoimmune diseases in women. And what you'll notice is that many of those are conditions you would have heard of before, like lupus or rheumatoid arthritis. What's really striking is that the men in the table, which is in the paper, those conditions are rare and unknown, and you are unlikely to have ever heard of them. This really highlights how different autoimmune disease is in men and women. I was also able to be an author on a recent JCI review paper where we looked at the mechanisms that drive sex differences in autoimmune disease. And overall, the data to date really suggests that both estrogen and genes on the X chromosome increase autoantibodies and autoreactive T cells in women. And this is what's really driving the increase in women.
An advantage of our model is that it uses a common data model and can be quickly and easily reproduced. We're planning to do that in the future so that we can determine whether autoimmune disease prevalence is actually increasing, as is commonly believed. It's difficult to do that with meta-analyses. The program algorithm is freely available to all researchers and can be found in the supplemental materials. The numerator and denominator and the gap between diagnosis codes can be adjusted independently, and it can allow other data sets to be used, so the program can be fine-tuned with additional parameters. If you have questions, you can contact me at aaron@autoimmuneregistry.org.